team, we're now going to talk about some of our trauma equipment that we have here. So I've got a selection of a few bits and pieces to have a look at. However, we're going to start by having a good look at our lower limb wound here. So this is one of our tourniquet models. So you can apply a trauma tourniquet to the wound itself and it will stop bleeding. As you can see at the moment, I've just got a gravity-fed system for our fake blood. So I'm going to turn that on now and then get this tourniquet in real time so you can see it not bleeding. Inside of the wound. No, it's deliberate. Just right, so I'm going to set our blood running now, so it should run very freely, just under gravity here, so you can see it's already bleeding. So I'm going to tourniquet the wound here. Get that applied. So you can apply the tourniquet reasonably tightly without fear of damaging the model. So that's a good 2 winds that I've put on the tourniquet there, and as you can see, the wound has stopped bleeding. So I'm now going to release the tourniquet so you can see the bleeding. You see that bleeding all right? Cool. So much the same as the lower limb traumatic wound that we've got here for our tourniquet application, we have this model here, which is obviously an above knee wound. So there are 2 wound sites on this model itself. So you have one side which looks more like a sort of entry gunshot type wound, and then on the other side a traumatic exit wound. Now both sides of this model bleed from the singular bleeding point. So in principle the models work in a very similar manner. So with this model here, the tourniquet area being just below the knee, whereas with this model the tourniquet area is just above the knee as to where the tourniquet is here. So now we're going to move on to our wound packing trainer. This particular model has 3 sets of bleeding points that you can infuse. Again, I'm just using a standard sort of gravity set here rather than a pump set, but if you want to simulate arterial blood, then by all means use a pump set to push that through a little harder, a little faster, and give a pulsatile nature to it. There are three wounds you can pack. One is an abdominal wound, one is a gunshot wound here, and the other is some sort of traumatic slash down the side here. So the one that I'm going to demonstrate to you today is this groin slash here. So I'm going to run the blood now. So you should see that starting to pool in there. So the silicone's very tough, so you can instrument it, meaning that you can pack with swabs, with instruments. So I'm going to try and pack this so it stops it from bleeding. So you can put direct pressure on. So once you're happy with the way that your participants have packed the wound, you'll be able to either lower the gravity set if you're using gravity, or just turn it off, making sure that the flow stops. So the model that we've got here for you today is a male model. We've obviously put the towel on for dignity, but there's a full set of genitals underneath. Currently the only model that we have available is with male genitalia. However, if you require female genitalia on your traumatic models, please feel free to get in touch with us, and it's something that we're very happy to try and produce for you.